Hi there, my name is Gabriel Mickarts. I'm going to be talking about eating disorders. This is for our Nursing 384. So, what exactly is an eating disorder? Basically, it encompasses a range of behaviors that center around either undereating or overeating. These are often accompanied with distressing feelings or emotions, um, and it result from the interaction between eating, which is inherently social and psychological, and the physiological. So the appetite regulation parts of your brain, your hypothalamus, they interact to cause these behaviors. It's important to note that it's not just about food. Sometimes it can be about control. Sometimes it can be just a learned behavior from when you were an infant. Sometimes it can be about a reaction to stimulus or um, like a PTSD, reaction to trauma, things like that. There are a whole host of things that cause them, but they are all centered around overeating or undereating. So the big three eating disorders are anorexia nervosa, bulimia nervosa, or binge eating disorder. So anorexia is generally characterized by a normally low body weight and strong feelings centered around distorted perception of the physical self, along with a morbid, like intense fear of gaining weight. This body dysmorphia and the fear lead to actions that prevent those things. So severe food restriction, excessive exercising, and binging. Um, Sometimes also purging. So it's important to realize that the point of this is just severe weight loss, which is one of the hallmark symptoms that you can see. And these behaviors to control this weight are often obsessively controlled in like a very minute to minute, calorie by calorie daily regimen. Every day goes the same way, and they're well known for scrimping and being very precise about um, what goes into their body. Often develops during adolescence or young adulthood. 25% are men, which is increasing these days. Overall, the entire population, 2.4 to 4.6% prevalence in your lifetime. Now, bulimia nervosa, again, is also um, comes about often in adolescence or young adulthood. The big characteristic is it's not about having a low body weight. It's about the binging and purging behavior. It's more associated with the guilt of binging followed by the shame of purging. And purging behavior is generally what causes the physical damage, because using laxatives or vomiting, diuretics, enemas, even exercise or fasting can cause physical damage. And you'll see things like tooth decay, acid reflux, severe dehydration. You can have all kinds of GI problems depending on what you're doing to get the nutrition out of you. And again, it's most likely women, but 30%, 36% are men. And the last one, the most common, is binge eating disorder. Uh, the definition is at least one time a week you're eating excessively more than a person would in that circumstance for at least 3 months, which is, when I think about our American diet, a pretty low bar. There's quite a few of us that eat more than they should, significantly more than they should for a meal at least once a week. Again, it develops generally in adolescence or early adulthood, but can happen later on in life. And weight is the obesity that results. It's almost always tied directly with obesity. Is the main chronic problem and the main physical problem that will occur. Some rarer ones, pica. This is about eating non-food items. It's generally an obsessive desire to eat things: dirt, chalk, paper, hair, cloth. These are not good things that you want to be eating. It's often linked to intellectual disabilities, developmental conditions, or mental health conditions. So the big ones are autism or schizophrenia. It also occasionally happens in pregnant women when they have a like a deficiency. It's not that uncommon for pregnant women to desire to eat like dirt, things like that. But eating non-food items leaves you in danger for being poisoned, basically. Also, all those things are not being digested. They're doing who knows what to your GI tract as it's going through. There can be blockages and all kinds of things. It can be very dangerous and fatal. So yeah, moving on. Rumination disorder. This is when after someone eats, within 30 minutes before it gets out of their stomach, they regurgitate it, chew it up again, either eat, swallow it again, or spit it out. And this can happen to people, or people can experience this at any point in their life. It's especially dangerous for infants because you're getting the food in them and then it's coming back up, might be spitting it up, might be re-eating it, aspirating it. It's very dangerous. It can lead to really low weights and low BMIs, especially for infants. And the last one here is avoidant and restrictive food intake disorder. This is, again, very common, or mostly common in young children that have like kind of developed an avoidance of food, whether it be they don't like the flavor or the taste or the look or the social situation. They don't like eating around other people, but it's way beyond being a picky eater. It's important here. They have a deep feelings about this. This is not, oh, I just don't want to eat my peas. It's, I don't eat anything when people can see me, which when you're a child can lead to drastically reduced nutrition coming in, and they're generally lower weight and poorly developed for their age. So why did I pick this topic? The big reason is that it's just really incredibly common, and we don't talk about it nearly as much as we do, or as we should. I mean, one of the studies I was looking at saw 14.3% of males and 19.7% of females will experience an eating disorder by the time they're 40. 1 in 7 men, 1 in 5 women. That's a huge amount of our population. And it's still kind of stigmatized as like, this is something that happens to teenage girls. With our society, and the way that we're really increasingly connected, everyone is on an app. All the apps have filters. When we talk about body dysmorphia and not being able to see yourself, that's the entire world now. Everybody's not looking like how they actually look. And that causes huge changes in how people look at food and their own bodies. And it seems like we're trending in the wrong direction. And I find that really distressing. That same study found that 70.5 deaths per 100,000 could be avoided if we just treat eating disorders for give coverage, insurance coverage, and medical coverage for all of them. So the impacts on healthcare quality. The primary impact of disordered, with regard to disordered eating, is cessation. If you have someone that comes in and they have physical problems and you get their fluids back up and you get their electrolytes back in balance, none of that's really going to matter in the long term unless they stop. And so the combination of physical and psychological care is really, really important. It's why almost the primary treatment is inpatient care. One of the big things in regard to binge eating is that almost none of the medications that are prescribed work. They just don't see a change. And they were tied in with cognitive behavioral therapy with the idea that you do the medication, you do this therapy, it'll work. No benefit, or very little benefit in the long term. Some short-term benefit. The big benefits come from what's causing it rather than a cognitive approach. It's like, this is a physical thing that's happening in your brain. This is a disorder of the brain that's causing you to want to eat this much. One of the other impacts to healthcare quality is just lack of knowledge regarding eating disorders. Like I said before, it's kind of thought of as like this is a gender and an age disorder, and specifically that it's not just women. It's with 25% of people experiencing anorexia and 36% experiencing bulimia are male. It's a pretty big number, and it can be really missed. The other one is that, and I skipped over it, but the lack of knowledge that eating disorders are not just about low weights, but they are also about overeating. Impact of safety, there's not really an impact of safety outside of the person experiencing it. But there are some acute dangers. Anorexia is really, really hard on the body, generally because they're not going to stop. They're just going to keep losing weight and keep losing weight. And fatal heart dysrhythmias are common in people once they get really, really low. Vomiting and purging for bulimic and anorexic patients also can cause bleeds and all kinds of things. Obesity is the huge thing with eating too much and with binge eating disorder within BED. Regulatory factors, there aren't really that many. There was one piece of legislation, it was the first ever passed in 2016, it was the Anna Weston Act of 2015, that requires some literature to be promoted and for eating disorders to be treated in the same way that substance abuse is with residential treatment, which is good. But that's about it on the regulation and the legislative fact. It can be incredibly difficult to find get reimbursement. This has only been going on for a few years. Literally, the system is not set up yet to reimburse people for treatment. There was another act that was going around Congress in 2019 for the PEOPLE Act that would have made nutritional programs for children in schools, and that did not pass. So the costs are huge. The NEDA, the National Eating Disorder Association, he says it's easily $30,000 a month. There was a study in 2015 said it was the average cost in total was almost $52,000 and almost 40 days of inpatient care. You can do outpatient like psychological treatment and stuff like that, but there's going to be there's going to be money for medications, and the level of treatment that you'd need for outpatient care, you're going to need multiple therapy sessions a week at 100 to 400 a time. That's thousands of dollars a month at minimum for minimum of care. Inpatient about $1,200 per day. So for social justice advocacy, big things are providing education and information about who experiences these eating disorders. Disordered eating is, like I've said a couple times, very, very stigmatized. And even in healthcare settings, people who are experiencing it slipped right through screenings. So speak out about unhealthy dieting and lifestyle as well to kind of help so we can see the forest for the trees at this point. And offering self is always important. Clients that are undergoing treatment are going to feel alone and isolated, and being able to talk openly will help them through the process. Advocating for legislation. The legislation that passed was great. The legislation that didn't would have been great too. That it helped provide nutritional plans and assistance for school children would have been amazing and very helpful. If nothing, because it would start talking about eating disorders in schools when this is starting, for a lot of people, starting to happen to them. And also, nurses can advocate for legislation that push eating disorders to be treated more in the same way as other disorders that impact health, so that insurance, healthcare provider systems allow people to get the care that they need in a way just like anything else. Right now, even though some of it is covered, it's impossibly hard to get it. You have to pay for it up front and then get reimbursed. And that's an incredibly hard bar to cross sometimes. And that's it. Here's my references. Thank you for watching.